Hello, this is James Lowry at James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering from immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is, what immune disorders cause gastritis? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. What immune disorders cause gastritis? Autoimmune gastritis causes chronic inflammation in the stomach lining and is often linked or attributed to other immune disorders in which the immune system mistakenly attacks parietal cells in the stomach lining, leading to poor nutrient absorption, especially that of vitamin B12, and also leading to iron deficiency and anemia. Immune disorders of this kind are such diseases as Hashimoto's, Graves' disease, type 1 diabetes, thyroiditis, and rheumatoid arthritis, just to name a few. At the core of many, if not all, immune disorders is some form of dysregulation present between one's neurology and one's nervous and immune systems. With all of that being said, is there a type of therapy or application out there which looks at regulating the interaction between one's neurology and one's nervous and immune systems? In fact, there is, and it is a branch of science known as psychoneuroimmunology, which studies how one's neurology and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology and its applications in the form of mind body therapies, such as hypnotherapy, is looking at where one's attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies, such as hypnotherapy, aim to therapeutically affect attention in this way to help people reestablish a healthy communication between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work for me. How is this different? Most therapies aim to alter or bolster your conscious perception of the problem. But if you could consciously decide right now not to have the discomfort you are experiencing, it would only be reasonable to assume that you would consciously decide to do so. Would you not? If you could have consciously decided not to have taken on the problem, the discomfort at all, again, it would only be fair to assume that you would consciously have decided to do so by now. So the problem, the discomfort, and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious part of the mind. So if you're looking to adopt this kind of therapy, one that focuses on the unconscious mind in such a way that helps you relieve the emotional stress surrounding your discomfort in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.